G'day, it's Paul McNamara here with part 2 of the session 10 lecture, Looking After Yourself in Clinical Practice. Look, this relates to those learning outcomes, but I'm skipping all the other ones that I've done in part 1 of the lecture and just talking about self-care in this one. Today's presentation is going to talk about a little bit about context, why we're talking about this, then some self-care strategies. I want to let everybody know about clinical supervision and a bit about getting support if required, extra support if required. So let's get started about context. This is straight from session 1, which you might recall, when we were speaking about self-awareness and about how self-awareness is about knowing how we're going to respond to specific situations, knowing our values and our attitudes and our biases, and how that might affect us and our work. And there was that reflective exercise that we did in session 1, which you may recall. And I just want to get us to revisit that before we go much further, because it might be a good idea just to spend a moment answering those statements for yourself. You chose nursing because the things that you're good at. And when you think of someone experiencing mental health difficulties, how do you feel about that? And what would you like to improve in yourself? The self-awareness is really important. We need to, I'll use a swear word here, I hope you don't mind, but we need to have an awareness of if we're having an emotional reaction while we're on clinical placement, is that our shit or is that the other person's shit? And I hope you don't mind me using that word, but that's the sort of language that you are going to hear while you're on clinical placement. You might recall, as part of your workbook stuff that you did for session 9, where I directed you to read my story about the emotional aftershocks that I had when I was quite afraid. This one day at work, the most frightening day for me at work, is where somebody up on a medical ward grabbed hold of a fire extinguisher and was really genuinely frightened. I was really scared. But that's really unusual. It's really important, I think, that I let you know, if I haven't mentioned this in a lecture already, to remind you now that I've been a nurse since 1988. I've been a mental health nurse since the early 90s. I think it was 93 or 4 I completed that course. Was it? God, I should know. 95 it was. That I completed the mental health nursing course, but I was doing it in the hospital, so I was working with mental health patients in the meantime. And I've never been struck by a mental health patient, not once. Most people with mental health problems aren't violent, never have been, never will be. And most people who are violent don't have a mental health problem. That's not, I don't want to sort of gild the lily. I think there's a really good chance that on clinical placement that you'll hear raised voices. You might even see, it depends where you're placed, but you might even see angry gestures. You'd be unlucky to see violence. Like, it could happen. I won't give you a guarantee I can't keep, but look, it's not part of my expectation of going to work every day that I'm going to be exposed to violence. I would have probably moved on to a different job by now. So it's really important to, I hope as best I can, to diffuse that fear that's probably not going to happen. What's almost certainly going to happen, as has already happened with this lecture, is that you'll hear swear words. There's this beautiful word, you pronounce this lalokizia, it's Greek, lalokizia, and that's the use of vulgar or foul language to release stress or pain, an emotional release gained by uttering indecent or filthy words. Shit, yeah. Look, you're going to hear, I would be really, really, really surprised if on clinical placement you don't hear people swearing, and if it's not from the patients or from the consumers, it'll be from the staff, where tend to be sometimes a little bit irreverent, the way we communicate, some of us mental health nurses. I know I certainly am. I do use swear words from time to time, not just to release pain and emotional stress, but also as adjectives. Now there is a little bit of a difference, and this is the reason I want to just reorientate you towards this. There's a big difference between using swear words as an adjective or as a mechanism of release and being abusive. Now I understand that some people do take offence at some swear words, you know, and usually that's graduated by what swear word is being used. But because people are using swear words does not mean that you're getting abused. Simple as that. Sometimes people are just expressing themselves using adjectives. If you want to take offence to it, that's okay, but that's going to be your choice, because I've already used the word shit 3 times. Oh, hang on, make that 4. And if you want to take offence to each and every time I've said that 4-letter word, you can, you know, that's okay. But that'll be an issue for you. It's not really about me. I'm not being abusive. I'm being a little bit irreverent, and that's okay. I'm kind of comfortable with that. And anyway, so you're going to get exposed to that. There are also probably going to be times where this clinical placement will be so different to what you've been on, is that you might find yourself getting some negative self-talk going on. And I think by now you've already been exposed to the word called rumination or ruminating, and this is such a beautiful visual depiction of what negative ruminations look like. Is that out of all the flotsam and jetsam of everything we hear all day, if we're feeling a little bit emotionally vulnerable, all we can hear, all we can focus on is the negative. And if you are, you know, going on clinical placement, or just getting stressed out by the subject itself, or getting overwhelmed by whatever else is going on in your life, is sometimes the thought that's bugging you, the thought that's turning over in your head when you're trying to get off to sleep, is the negative stuff. And sometimes that's the way it is. I hope you don't get that sensation from being on clinical placement. As I've probably mentioned already, I think mental health's one of the more dynamic, more fun specialties in nursing, and I actually go home most days feeling pretty good about myself, that I've been able to engage with somebody, and might not have cured cancer or saved the world, but for 1 or 2 or sometimes 3 or 4 individuals, I've been able to spend some time with them, or authentically give of myself and engage with them. But I know I, like everyone else, sometimes have bad days, and you go home and you've got that heavy negative stuff going on there. So what do we do about it? Well, I'm so glad you asked. Let's move on to the second part of the presentation, which is about self-care strategies. Excuse me. Remembering from that session that we did on anxiety, and I spoke about in the lecture about anxiety, about the stress response. Our bodies haven't evolved all that much since we were cavemen. When you're a caveman and a saber-toothed tiger walks into your cave, you need to respond. All of your body needs to respond, not just your thoughts, all of your body. And that's what happens with our stress response. Our whole body responds. Our heart beats faster, our breathing gets shallow, our blood circulation, the peripheral circulation shuts down a little bit. Sometimes you can feel really nauseous. What's the body going to be doing? This isn't the time to be digesting sandwiches. This is the time to be running away from or fighting this bloody saber-toothed tiger. It's a real danger. I'm in danger of getting killed here. Those of our ancestors who didn't respond that way, they didn't survive. We haven't got their genes. We have only got the people who have got a good, fast stress response. These are our ancestors. So there's this whole body response, and it's all switched on, and it's an adrenaline response, and it's a good response. It keeps us alive when we're cavemen and the saber-toothed tigers. So that shallow breathing, fast heartbeat, sweaty, profuse, you might be hyper-vigilant. Every little noise, every little sound you're responding to, that's the stress response. So if you're getting that, we can use the same stuff that we spoke about in that anxiety stuff. When we're talking about anxiety and panic, the best medicine is to use slow breathing exercise. Why? What are you, some sort of hippie? No, I'm not a hippie. I'm a scientist, Ben. Yeah, a scientist. We're using the parasympathetic nervous system to, and we're hacking the brain, we're tricking the brain, and we're putting it into a state where it's at rest and repose. How does this work? A reminder. When we're asleep, we probably sleep at about, probably breathe at about 10, maybe 12 times a minute, give or take. It'd be a little bit different if you've got asthma or something maybe, but that's generally about it if you're in a nice deep sleep. So, our dumb caveman body thinks there's a saber-toothed tiger in our cave. We look around, we think, you know what, there's a complete absence of saber-toothed tigers, complete absence of caves here. Our dumb caveman brain needs to be hacked, and this is what we do. We hack it by doing slow breathing. Nice to talk about it. Why don't we try it? I'm feeling a little bit self-conscious about it, and you might too, but you can fast forward through this section if you don't want to. But let's not talk about it in theory, let's actually just take some time and do this. And we'll start it by holding our breath, and we'll count to 5. 1, 2, 3, 4, 5. And breathe out, so relax. Then breathe nice and slowly through your nose. If you've got a clock or watch with a sweeping second hand, keep an eye on it and breathe in for 3 seconds and breathe out for 3 seconds. But if not, I'll see if I can mimic about that cycle and talk you through it. So we're breathing in for 3 seconds, and now I'm breathing out for 3 seconds, saying relax. Breathing in for 3 seconds, and now relax. I'm breathing in for 3 seconds, breathing out. You're breathing in. Just noticing there's here in the building it's late in the work day, and so most of the people have left, but I can still hear some noise coming through. And as you hear those noises, you'll have your own distractions in your room, and you'll just thank your brain for noticing that. Thank you, brain. I'm glad that my senses are working, and you'll unhook yourself from that, and you'll come back and just focus on the breathing. And so I'm breathing in for 3 seconds, and breathing out again. And every now and again we'll come back to just making sure that we hold our breath again for 5 seconds. Make sure we don't get too rushed. So we'll do that now by holding our breath for 5 seconds. Going 1 and 2, 3, 4, 5. Breathing in. And then breathing out, saying relax. I'm going to stop talking now and just let you do that by yourself for a while. With this slow breathing, I can feel it in my shoulders. I've had a fairly busy day, but they're just a little bit looser now. They've just kind of dropped half a centimetre, and it just means that my dumb caveman body has been hacked. My dumb caveman brain thinks that I've gone to sleep, and some of those stress responses, those autonomic stress responses, have been turned off. So hopefully I haven't bored you to tears or put you to sleep, and you're still with me. But can I recommend using that yourself? Maybe not while you're driving. Yeah, it's not so good if you fall asleep while you're driving. But use it yourself. It's a cheap, affordable way to manage stress. There's other ways to manage stress, of course. Like you could go down to Dan Murphy's and spend all your money there. But this one actually you can do before work, where drinking wine or beer before work is sort of frowned upon a little bit, and also this is a fairly healthy thing. As far as we know, there's no unwanted or long-term side effects from getting control of your breathing every now and again. So this is a good thing that you might get to practice while you're working with consumers on your clinical placement, but if not, use it on yourself maybe. It'd be a good idea. I'd really recommend, I'm just assuming everybody's got a smartphone by now. If not, you don't actually need the phone. Both these things have got have websites, Smiling Mind and Mind the Bump. Mind the Bump's for if you happen to be a an expectant or new parent. That one's kind of geared up more for you. And for those of us who haven't got a bun in the oven or haven't got a newish baby, we would probably be better off using Smiling Mind. Both of these things are evidence-based. They're being rolled out with the support of Beyond Blue. They get a lot of the federal mental health funding, always evidence-based stuff. And they use mindfulness exercises like we just had a bit of a try with there with the slow breathing. Get it on your phone. They cost nothing. They're good things to practice for your own sanity, for your own health, for your own stress management. But also in using them, you might pick up a trick or two that you'll be able to pass on to patients or friends or family. Who knows? So those are some of my suggestions around self-care. The only other one, and I've brought this up before too, is that we, nurses, the psychopathology of nurses is that we've got more empathy than most people. We are a bit more obsessive than many people, probably most, and we tend to get a little bit caught up in a I don't know, the idea that we need to be everything to everybody. Look, none of us can, but we can probably all be good enough. We can let ourselves off the hook. You don't have to be perfect every minute of every day. You can be good enough. And I think just acknowledging that the psychopathology of me as a nurse is I've got more empathy than most people. I'm more likely to be working shifts, and I'm more likely to be obsessive than most people. And sometimes I'm just going to have to let myself off the hook there a bit. I'm going to just allow myself to be good enough. And that's a cognitive strategy, a cognitive behavioural strategy to help us manage our stress. So they're the self-care strategies. I just want to run through, for the next few minutes, a bit of a story about clinical supervision. So yes, let Uncle Paul tell you a story. This story is about miners and about Pithead baths. Once upon a time, it's the best way to start a story. Once upon a time in Wales, about 100 years ago, the Welsh coal miners, they would go down the mines every day and get covered in mine dust, and they said to the mine bosses, they said, you know what, like, we work in your mines all day and we get really dirty with all the dust from the mines, all the muck and grime from the mines. Then we walk home in our own clothes and go to our own bathroom and get scrubbed up there and hand the overalls to the missus or do the washing myself or whatever and get the clothes cleaned up. And I reckon because I get dirty and my clothes get dirty on the boss's time, probably me and my clothes should get cleaned up on the boss's time. Anyway, the mine bosses, you could just imagine that they were exactly there back then as they are now. They went, oh no, you can't possibly do that, we'll lose all our money, said the Gina Reinhardts and Andrew Forrest of the world. And so they said, no, we can't provide you time for showers and everything. You're here to work, you're miners, here to do mining stuff. And so the Welsh miners said, well, that's no good. So they went on strike, and they stayed on strike until the mining bosses finally gave in, and they built into their contracts, into the contracts for all miners, this thing that's called pithead time, and that is at the end of a shift, using the infrastructure that we've built into the mines, you get yourself scrubbed up and clean to go home on the boss's time. You haven't clocked off while you're having a shower and getting yourself clean, and that's the way it works, and it's enshrined in mines all over the place now. Why am I talking to you about mining? Well, because it's a good story, and also because it's that whole idea of getting cleaned up on the boss's time. And this is Todd and Brant, you know, the Beaconsfield miners. This is them clocking off. They spent, I think it was a fortnight underground, wasn't it? And in a tiny little space, so they would have been covered in their own feces and urine at times, and they would have been covered in all the dirt and grime that was down there and whatever else was going on. I know they had food and stuff, but they spent a fair bit of time probably being frightened that they were going to die. So yeah, they would have been really messy guys at the end of that fortnight. But before they left the mine proper, they were rescued from their spot and while they were still within the mine, before they came here to clock off from their 2-week-long shift, as it turned out to be, they stopped and they had a shower and a change of clothes. So this pithead is built into the infrastructure of mines. I'm wondering now, why am I telling you this story? Because nurses don't tend to get all that covered in grime like coal miners in Wales or trap miners in Beaconsfield do. But we do emotional labour. We do get covered in the emotions of others. Sometimes people in hospitals, not just on their mental health placement, in hospitals generally, in health systems generally, are having the worst day or days of their life, and they will express those emotions. There'll be sadness and there'll be fear and anger and all sorts of unpleasant emotions, and we're going to have a front row seat to those, and of course it's going to have some sort of effect on us. And we should start thinking a bit like the miners do. Hey, I wonder if I'm getting grubby on the boss's time, maybe I should get cleaned up on the nurse's time. This is why I'm telling you. Maybe I should get cleaned up on the boss's time, that's what I meant to say. This is why I'm telling you this story. So is there infrastructure? Well, yeah, there is. In mental health there is anyway. Part and parcel of being a mental health nurse or any side of mental health clinician is that we are not just allowed to, in fact encouraged to quarantine some time away from the clinical area. For me it's usually just an hour or so every month, but look, if I was a brand new clinician I might be aiming to make that like an hour or so every week, where you step away from the clinical area and you reflect on your work and reflect on how that's affecting you. That's called clinical supervision. Now supervision sounds like scrutiny, but it's not. It's quite different to that. It's a supportive thing, and look, to be honest, I would imagine that I would have gone like completely nuts without having good clinical supervision over the course of my career. I've been really fortunate to have some terrific clinical supervisors who have been able to just help me reflect on and understand some of the experiences I've had at work. Often highly emotional, sometimes quite distressing experiences, because even if it's not about me, like it was with Fire Extinguisher Guy, that was about me, that was about my fear. But even when you've got a front row seat to somebody else's tragedy, to pretend that has no effect on you, I think it's a little bit unwise, and I think sooner or later that might catch up with you in some way. So clinical supervision, it's a thing. The Australian College of Mental Health Nurses, who set the standard for mental health nursing, they think it's really important too. They've enshrined it, so it's not just me and it's not just Queensland Health. The profession thinks it's a really smart idea. I guess my only question is, if it's good enough for mental health nurses, why isn't it good enough for general nurses and midwives too? But anyway, that's a question for a different day. Now, back to the textbook. Enough storytelling. Let's tell you this story from the textbook. There's this definition of clinical supervision as a positive process that involves reflection, there's that thing, of clinical interactions and interventions by one clinician to another more experienced clinician for support, professional development, education and development of clinical practice skills. Look, can I tell you, I like Elder Evans and Nizette's book. I think it's a really good one. I hate that definition. I reckon it's waffle. So I've got a better one. This is the model by Bridget Proctor. She's British, and she's kind of one of the rock stars of clinical supervision. There's something I can tell you about Bridget Proctor, that she likes words that end with A-T-I-V-E. But also, she's really simplified what clinical supervision is really about. Let me go through this with you just fairly quickly. So the formative component of clinical supervision, what happens in that is that's where we learn. That's the educative stuff. That's where, by reflecting on our work with another clinician, we can develop our skill sets and our knowledge. That's formative. So that's one of the functions of clinical supervision. Another function of clinical supervision is the normative, and sometimes we can find ourselves in a bit of an ethical pickle. We've used the example previously of like say working with an involuntary patient or involuntary consumer in the community. And so sometimes we're imposing ourselves on them, and we think, oh God, am I overstepping the mark there? And it's really good to be able to discuss that with a trusted colleague, and that's where the normative stuff comes in. Am I breaching, codes of ethics? Am I breaching codes of practice? Or maybe in talking about what's going on, your clinical supervisor will go, oh, actually, you know what, I'm just wondering whether we should revisit what the rules are around that, because sometimes we can have a blind spot. We don't know what we don't know, and so we might actually be making a bit of a goose of ourselves without realising it. So that's the normative function of clinical supervision. And finally, there's the restorative function of clinical supervision. This is the bit that I'm I guess, especially passionate about, is that's where we get to be nurtured ourselves. So we're in a nurturing role as nurses, but I think that this is a time for us then to reflect on how things are affecting us emotionally, and think and discuss that openly and without fear of being judged or blamed for emoting about some of our work, because we do some sad stuff. People die, and people have awful traumatic things happen to them, and as I say, I think to pretend that that's not going to have some sort of effect on us every now and again would be foolhardy. Yeah. So that's the Bridget Proctor model of the functions of clinical supervision, and as I say, I find that one a little bit more useful than the one out of the text. So that's all I really want to say about clinical supervision. The last quick little bit here, you'll be mercifully pleased to know that I've just about finished, is about getting our own support. And this is a delightful little cartoon. I'm not sure if you can read it on the screen that you're watching from, but it just has a lovely little example of how would it be if we treated physical health problems like mental health problems. And so the one I'll just point out here is while somebody's leaning over a toilet and vomiting, the other person saying, have you tried like not having the flu? And I think sometimes when people are feeling very anxious or very depressed, sometimes well-meaning but kind of dopey people will say dumb things like that to people who are feeling really, really stressed out. Have you tried just relaxing? Yeah, I've thought about that. So I guess that's just a playful way just to conceptualise that sometimes you need to go to somebody who kind of gets it if you want to get support. And I would suggest for you guys while you're at uni, the smartest thing to do is, if you're thinking, you know what, maybe I do need a bit of a hand managing my emotions at the moment, I'd go through the JCU Counselling Services, and I've got the numbers there for both Cairns and Townsville. They've also got an online thing if you don't think you necessarily need to speak to somebody face to face, but you just need to try some new strategies out. There's their online self-help stuff, which is at thedesk.org.au, and I had a quick little play with that the other day, and looks like some nice little basic CBT and mindfulness things. And so it might be worthwhile just having a play around with them anyway, even if you're not feeling overwhelmed. Alright, so that's all I've got to say about the self-care stuff, and thanks for listening this far. Cheers.